Swadika, very good evening and welcome to Thai PBS World Tonight. I'm Nad Bunag.
I'm Tulip Naksompop.
And for today's program, we have an exclusive interview with Public Health Minister Anutin Charnvirakul.
Yes, yesterday we had a chance to sit down with him just one-on-one. It's all about the vaccine, the rollout in Thailand. That because we have our correspondent went out on the street and talked to a lot of people, and there's a lot of questions, and we want answers. So we were lucky enough to have time to sit down with Mr. Anutin. And here is the exclusive interview. Let's take a look. We went on the street to talk to a lot of people, and one of their concerns is they feel that the inoculation program is too slow.
It depends on where the question came from. If the question came from people who got infected or people who relate with those patients, of course they will have to say it's too slow. If we refer to the agreement that we have purchased the vaccines with our suppliers, it is timely. According to the contracts that we signed, AstraZeneca, who is the principal vaccines for Thailand at present, will begin to supply its products from June 1st onward. June 1st.
Is this the one manufacturing in Thailand or the one?
Yes. And we signed a contract since October last year. So in October last year, we were able to control the situation quite satisfactory. So that means we were not careless. We purchased these vaccines during the time that we had no domestic infections at all. We were able to convince the vaccine makers to establish the production line in Thailand. Once we have this production facility based in our own country, so it guarantees that we will never be short of vaccines. But however, isn't it because of the government being so well prepared? So that's why once there were two major outbreaks taking place in a very short period of time, the health system is still prevail. And we hope that the worst must have come already. And once we are able to get by this cycle of infections, which began at the beginning of April, together with vaccines, as I said before, formations of hospitals as well as the field hospitals, and experiences that our health workers have gained throughout the period of time. We hope that the situation can only get better.
Then it's come the question of efficacy. How do you ensure that the vaccine we have, Sinovac and AstraZeneca right now, is
AstraZeneca immunization grows up very quickly, even getting the first jab. Sinovac vaccines, after 2 doses, also produces good efficacy. And we don't limit ourselves to only these 2 vaccines. Now we are dealing with many other vaccine makers who just started to send in documents and application for registration. So in the next few months, we surely will have choices of vaccines for our people.
Last question, it might sound a little bit political, but it's a question raised by some political scientists, say that people that view that you are being isolated when the Prime Minister appoint a committee to oversee the vaccine procurement or the management, or when he take all the control under himself again. Why do you think they feel that way? Do you agree with their view?
As I said, they are not my colleagues. They don't know how we work. I work very closely with the Prime Minister, and I can say that I have personally assist my people in the Ministry of Public Health to negotiate terms and conditions. When the Prime Minister appointed this new team to provide vaccine, and he called an alternate vaccine, that is for private sector. He must have understood that I work very hard and I have been ordering vaccines for public. So he just established another working group to, provide vaccines for private sector based on their request. I don't have time to deal with private sector. I have to deal with 70 million people. I have to make sure that all of them will receive vaccines, as many as I could. So I think people will just try to look from outside that there might have been conflicts among the Minister of Health and the Prime Minister. That thing can never happen. Especially for myself, I obey the rules. And the Prime Minister is my boss. I do whatever he orders me. And I will always follow his instructions. And I will always help him to get through this period. This kind of situation, no one can fall. Either we rise together or we fail together. And failure for us is not an option. So I don't think this situation will nail us down, and we will continue to work together in the same direction and target that we will sweep this virus away for the benefit of everyone who lives in this country.
So he said that if there's nothing go wrong, by the end of this year, everybody or 70% of population will be inoculated, which will enable Thailand to reach the level of herd immunity.
Definitely.
And if you want to know more about anything or this interview in text, you can check our website, www.thaipbsworld.com. We have YouTube, Facebook, Instagram, Twitter, and TikTok as well.
And that wraps up tonight's edition of Thai PBS World Tonight. Thanks for watching, and we'll see you next week. สวัสดีค่ะ
สวัสดีค่ะ